And welcome back. The Alliance for Positive Change is a not-for-profit organization and multi-service group that's providing low-income New Yorkers living with HIV and AIDS and chronic conditions with access to quality health care, housing, and a path to jobs. Now, a federal 340B drug pricing program has given low-income patients and their communities necessary resources and services through discounted drug prices. On April 1st, a carve out of this benefit will take effect if the state does not permanently repeal it and replace it. Joining us now is the Alliance for Positive Change's Program Manager of Criminal Justice Initiative. We're pleased to have Eugene Epps, and then also the Director of Administration, Brooke Montes. And thank you so much for being with us.
Thank you, Daren.
All righty. Well, Eugene, take it away a little bit. For somebody who may not be so familiar with the Alliance for Positive Change, walk us through a little bit about the organization and how you serve the community.
I love that organization. So we primarily serve a community with New York City residents that has chronic illnesses. We serve the Black, Hispanic, Latino community. We also have supportive services at the Alliance for Positive Change. And we also serve the English and Spanish speaking bilingual. Each person we serve, we meet them where they're at.
And Brooke, for yourself, your work with the organization, talk to us a little bit about the work that you do.
Yeah, so I work with Eugene, and as the Director of Administration, I also oversee our treatment adherence program for people living with HIV to have access to medication through pharmacy access, supportive services, and really addressing anything they may need that would keep them from taking medication, like food and nutrition, housing, care coordination, and peer navigation.
Yeah. And so we talked a little bit in the intro about the 340B program. So for somebody maybe not be so familiar, Brooke, how does the 340B program work?
Yeah, so 340B is a federal program that allows safety net providers like Alliance for Positive Change, other health clinics, HIV clinics, to purchase medication at a discounted price and get reimbursed at a higher rate. We then take that savings and we increase access to medication, low-cost medication or no cost, and other supportive services that really address the health disparities that would not otherwise be reimbursed. For Alliance, that means healthy meals, transportation, the peer workers and community health workers, and also the treatment adherence program and pharmacy access center that I oversee.
Yeah. And so there is a potential impact that comes through this. And I want to let our viewers know a little bit more about, from your perspective, how you feel this will impact the community and those that you serve.
Yeah, so the impact is going to be really devastating. What the state is trying to do is carve out the pharmacy benefit from Medicaid managed care into a fee-for-service model starting April 1st. So that would prohibit safety net providers like Alliance for Positive Change to access those 340B savings that we reinvest in care. It also would disintegrate the care for thousands of Medicaid beneficiaries across New York State. And it's really just bad public health policy. But for Alliance specifically, it would totally dismantle our treatment adherence program. For the 1,000 people in the program who take their HIV medication every day, 95% are undetectable. So the amount of virus that's in their blood is not detected. And that's good for positive health outcomes for the individual and the community at large. So this carve out really is just taking money out of community and the supportive services of the community and sending it back to Albany, to DC, so that the state can try to manage it.
Yeah. And I want to bring Eugene in and talk about this from his perspective. How do you feel that this will impact yourself and others?
Well, I'm hearing negative things, especially from my clients that I serve. And then some negative impact things that we're hearing from the clients and myself included is, do we forget about the ETE, ending the epidemic? Like all of the work that we put into help to end the epidemic would just be thrown out the window. And, my clients are saying the AIDS cases may rise again. We didn't hear anything about AIDS cases, but the AIDS cases will arise. U equals U, transmittable. undetectable equals untransmittable. So people have a rival load. Now, we're gonna have another epidemic. We just came through a pandemic, and it's just all the way around the board bad for our clients. Time wasted, chasing our tails, and some clients are saying that it's a ploy for population control. They worried about their health, and possibly dying.
And there's a message that I know you guys are trying to get out in terms of elected officials and community. Brooke, what's been the response as you begin to share concerns, particularly amongst government and community?
Yeah, so Alliance for Positive Change is a member of the Save New York Safety Net Coalition, and together we are calling on the governor and our state legislator to reject the pharmacy carve out. Our very own Senator Rivera of the Bronx has introduced a bill S5136, and our health chairs in the Senate and Assembly have put a rejection in the one House budget. So we really thank them for leading the charge, and we want to call on them and the governor to stop the carve out before April 1st. Providers are facing a fiscal cliff, but even more importantly, as Eugene highlighted, the people who rely on our services will be forced to use the state system, call a 1-800 number if they have issues accessing their medication, when the program and the services should really stay in the community and stay with safety net providers.
And Eugene, what are you doing in terms of talking to your clients? I mean, you already said what some of them think, some of them feel, what you yourself feel. How are you getting the word out amongst your clients? And do you find that your clients are going to be actively involved in raising their voice to this?
Well, I think, yeah, that we already active in raising our voices. We in Albany, we at speak outs, we at meetings, we active when we can be in the community on top of serving the clients. And it's tough, to manage. We just came out of a pandemic. We just started getting back to work, and we have this. It's like, what do we do? But keep fighting. The line since I been there and since I came there, it has taught me resilience. Um, we figure out we have a problem, we figure out what we're gonna do, and then we bring up a team that's gonna fight for what's right for our people. And I don't think we deserve to suffer.
Brooke, for yourself, take us back to the time of COVID and really now that we're on the downhill slope of it. What was it like for the organization? How was the organization impacted in terms of being able to provide services and meet your constituents?
Yeah, that's so important. And I will highlight that this proposed carve out was an idea that was pre-COVID. So right now we've really seen that health inequity have been exacerbated and really highlighted during the pandemic. So to take a carve out from the people who need it, that really were the hardest hit from the pandemic, is just really bad policy. Also, the 340B savings allow safety net providers like Alliance for Positive Change to address public health crises as they happen. So when the pandemic happened, we were able to use that 340B savings to have access to testing, to treatment, to the vaccination, and we were able to do that like in real time. So if 340B were to go away, the same thing with MPOX, we wouldn't have that ability to address public health issues when they arise.
Yeah. And Eugene, for yourself, hearing what's going on and hearing the impact that potentially could happen by this possible legislation going through, for yourself, who's been a part of this, how has the organization actually impacted your life?
Well, in a great way. I'm just as impacted. I've served 15 years in prison. I came to the organization looking for housing, independent housing, and they helped me through all of that. They helped me through job training. I did the peer training, peer education recovery program. I did health coach. You name it. They just encouraged me on my way to live healthy. And I'm with them.
Yeah, yeah. And Brooke, for yourself, obviously, a lot of time and effort is going into bringing awareness to this particular issue. Are you optimistic that something will happen before the deadline?
I am. I really want our elected officials to help do the right thing for the people in the communities who rely on them. So really, we're not giving up the fight. We're calling on the governor and our state senators and state assembly people to help push forward the alternative plan. It really does have broad stakeholder support. And actually, I explained this issue to a friend, and she asked me what's best for the consumer. And I can honestly say for consumers and for New Yorkers as a whole, the stakeholder supported alternative is the best thing. By keeping the mechanism in managed care, it helps us to address these social determinants of health, health inequities for the people who really need us and rely on us.
So, Eugene, for the people who are out there right now who may want to be galvanized to get on board and really support after seeing and watching this, what do they do? How do they become a part of raising their voice?
If you want to raise your voice, you could go to www.alliance.nyc. You could go on newyorksafetynet.com. You could also Google information about your state senator for information to get on board with us. Or you could visit one of our 6 sites. We have 6 sites around New York City. You could visit one of those sites and meet with someone down there.
All right, we want to make sure that people get tapped in there because certainly as we continue to raise our voice about this issue and bring it to light, I think there are some that are going to want to join in on the chorus that's already been out there. Brooke, yourself, the organization. Alliance, talk to me, Brooke. What do you have coming up in the future? I know this is a heavy issue that we got at the forefront, but there's still more work to do throughout the year.
Right. We're going to continue standing up for the New Yorkers who rely on us. As Eugene mentioned, we have 6 sites across the city, including supportive housing in the Bronx. So really expanding access to our workforce initiative so people can get job training, supportive employment to get back to work. Also through our Lower East Side Harm Reduction Center, we're helping to address the overdose crisis, providing Narcan training, providing overdose prevention toolkits. So really, we're here for the people who rely on us to increase access to healthcare and help people live healthy lives and really pursue their chosen pathway to positive change.
Yeah. And Eugene, from you who work firsthand with clients, talk to me a little bit about some of the challenges that you're facing in getting the work done and some of the real challenges that are prevalent among some of your constituents.
Some of the prevalent things that we that's challenging is housing. Housing has been a challenging thing for our clients. Myself, I had housing challenges. That's what led me to primarily to the Alliance from the beginning. But we worked through a foundation, building a foundation. Without a foundation, everything else is shaky. So we work on our foundation.
Yeah. And so people will definitely be taking part in listening more about the 340B program. Certainly want to allow our viewers to tap into Alliance. And once again, Brooke, for people who want to get in touch, how do they go about getting in touch with you and Alliance?
Great. If you would like to get in touch with the Alliance, it's www.alliance.nyc. And if you want to take action to save New York Safety Net, it's saveNYSafetyNet.com.
All right. Well, Brooke, Eugene, I want to thank you both for taking the time and sharing with us. Very important topic, 340B. Glad that we can enlighten our viewers as to the impact that it would have within the community. So thank you so much for being with us. And
Thank you.
we'll definitely stay connected and follow this story.
And come on, Bronx, help us out, Bronx.
Yes, indeed. Yes, indeed. Brooke, all right. Thank you, Eugene.
Thank you, Daren.
All righty, listen, we're taking a quick break. We do have more show. We don't want you to go anywhere. We will continue with more on the Social Justice Forum right after this.